The purpose of our study was to define surrogate perceptions of disability states after traumatic brain injury. We commonly use the Glasgow Outcome Scale Extended, or GOSI, as a measure of disability and recovery in patients who have experienced a traumatic brain injury. However, this scale has not been informed by the input of persons with lived experiences. We conducted a national cross-sectional survey of surrogates of TBI dependents with their hospitalization occurring at least a year prior. We used a common methodology called the Standard Gamble approach to determine health utilities for each of the GOSI disability states, ranging from GOSI 2, a vegetative state, bedridden and unaware, to GOSI 8, a good recovery. We obtained complete results from 298 surrogates, and their dependents had a median GOSI 5, which corresponds to independent but unable to resume work or other activities. 91% of the surrogates valued a vegetative state as worse than death, and 2/3 rated GOSI 3, bedridden but aware, as worse than death. Of note, GOSI 4, which is the highest of the dependent GOSI states, was also rated as worse than death by 40% of the surrogates. This GOSI level in particular differed from the general public unexposed to TBI patient care. I do want to highlight that this work is novel and hypothesis generating rather than practice changing. We look forward to exploring further the experiences and preferences of TBI surrogates and the survivors themselves at GOSI 2, 3, 4, and 5 levels of functional status in particular, where voices are lacking and much gray area remains, with important implications both for clinical practice and for future TBI clinical trials.